Hi, my name is Gallagher. I am a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. In this video, I'm going to talk about some considerations of taking care of your new vagina in the long term. So, after you're done with all your surgery, healed, recovered, what are some of the things you need to keep in mind as you move forward? So, the first thing I will mention is that you do have to know your anatomy. So you do have to understand that you do still have a prostate there. It's usually a small prostate because of the combination of effects of the estrogen and the low testosterone, but it's still there. And indeed, there have been reports, it's extremely rare, but there have been reports in transgender women of prostate cancer. So really, if you have it, it needs to be checked. In most of these reports of patients who develop prostate cancer, they usually didn't transition to later in their life. So it's thought that if you start hormones or transition earlier than the age of 50, again, this is exceedingly rare. Your doctor, however, does need to know that there is a prostate there, and the best way to check it, if it needs to be checked, is through your new vagina, not through the rectum as was done before. So that's number one. The second thing about having a prostate is that if you are to develop a urinary tract infection, so if you get that lower belly pain, the burning, needing to go to the bathroom a lot, and your doctor checks you and finds that you have a UTI, it's important that your doctor knows that there is still a prostate there. The reason for that is in some cases, when there's no prostate there, so in the case of cisgender women, if we have very simple, straightforward cystitis or a bladder infection, we can give, depending on the antibiotic, as little as 3 days of the antibiotic. This, however, will not clear the infection more than likely if there is a prostate there. So oftentimes your doctor will have to do a longer course of the antibiotic, and therefore she or he needs to know that you do have a prostate there. Whether or not you need annual pelvic exams or inspections of inside the vagina, it's a little controversial. There's a few guidelines on this. As a general rule, for example, the UCSF guidelines recommend a check about once a year. This is probably wise for a few reasons. You want to check inside, make sure there's no skin changes, no growths, and if you are, of course, sexually active, all the usual STIs would need to be ruled out. So again, like many things in gender affirmation, we're still coming up with long-term guidelines on what the best way to screen for things and check for things are. But you always have to have that what we call anatomy inventory, meaning that your doctor has to be fully aware of what anatomy is present and check for it accordingly. And then, of course, I'll mention it because I don't seem to be able to do a video without mentioning it. Dilation, of course, always is going to be necessary. We don't really think currently that it's possible to ever give up dilation. Certainly, penetrative intercourse counts as dilation if you are in a relationship and you're having frequent sex, but it may not be enough. We think in the long term it may be safe to go down to 3 times a week, but again, this is not necessarily the case in every patient. And if a patient is noticing some tightness is present, they do need to go back up on the amount of dilation they're doing. So I hope this is helpful for long-term care of the neovagina.